Hi, my name is Dr. Alison Lee. I'm a general pediatrician in SBCC at Rivervale Plaza in Sengkang. We practice general pediatrics. I have a special interest in allergy and immunology for pediatrics. That means we see conditions such as children with eczema, food allergies, chronic urticaria, asthma, as well as allergic rhinitis. And we also see all the conditions related to general pediatrics as well, of course. As far as I can remember, I have always wanted to be a doctor. Initially, it was probably to want to save the world, go out there and treat the starving children overseas. But realistically, when you have your own family, it's hard to do that. So now my service comes to people who are closer to me. And being in Sengkang, where there are too many young working parents who are also struggling themselves with young children, bringing general pediatrics as well as the specialty field of allergy to the heartlands and nearer to them in an established way, I feel that my main goal at the moment is to just serve them and to help them along and help them understand the growth of their child and of course assist their children in any illnesses that they have. So this would be probably my current goal and achievement into helping the local area at the moment. I feel that the most challenging phase in my career as a doctor was when I had children, as well early in my training, when we were still doing 30-hour shifts. It was difficult to juggle between my children at home who were crying and needing a mother, especially when they were sick too, as well as juggling with the children in the hospital who needed lots of attention and care in their moments of illness and difficulty. I can use that challenge, however, I felt as a means of understanding better, understanding my patients, understanding the parents. It really helped me empathize a lot more. I used to be fairly rude as a very junior doctor, not really understanding what anxious parents were going through, but having gone through it myself and having to do the same thing, it really helped me understand where they were coming from, why they were worried. And I put that to use in my practice as a pediatrician especially. And I feel that it has provided me with more education than even my medical school. It's not in the textbooks, raising children, and even I had lots of problems raising my own children, and so I can sort of feed from that and understand parents better and help them in that way. One of the definite proudest moments in my career as a pediatrician would be when we helped a child with a very rare immunological disease from overseas, who basically did not have that much money, be diagnosed with this rare condition as well as have a bone marrow transplant. It was a very difficult situation for that child, and even from the medical team's point of view, we could not directly help them financially, and they had to raise their own funds and go through this bone marrow transplant, else they would lose their child's life. So when the mother sent us photos back of him in his house in Vietnam actually, I think we were all very proud of that moment because we did almost lose him. And he fought back because that's the brilliant thing about being a pediatrician. Children are very hardy, they will fight to the end, and so will their parents. So probably that was definitely our proudest moment. The principle by which I practice is that to treat every child who walks into my clinic as if he or she were my own child. I think about what medicines, what blood tests, what procedures, what medications they may need, and whether I would give this to my child. And I hope that guides me in my practice so that at least the way in which I relate to parents is sincere and genuine.